Uh, hello, Mr. Firstly, I want you to introduce briefly of yourself.
Okay, I'm Dr.Morgan. I'm French emergency physician, and I'm living in Vietnam now for 2 years and a half. And I'm working in international SOS company for
nice.
3 years now.
Oh, very nice.
Yeah.
So, how long have you worked in Vietnam? 2 years and a half?
Yes.
2 years and a half. And before that, have you worked in any other countries?
Yeah, I worked 3 months in Singapore.
Singapore?
Yeah.
And so I want to focus on the differences between French and Vietnamese communication. And could you please tell us the main differences?
The communication is different. I mean, first the language, yes.
Okay.
Here the working environment is international, so the language is English in all the company and also in Vietnam. The language is an issue outside, outside the job, because here all the staff, especially Vietnamese staff, is speaking English almost well or very well. And the big difference in communication is more between the difference of position between people. I mean, in France, for example, in medical business, if you are a doctor, a nurse, or administrative staff, everybody is same level in communication. Everybody is not a doctor or nurse or whatever. Here, no, you have to respect. Very important. Every staff call me doctor, and the nurse we have to call them nurse. And okay, so that's a big difference. Very formal, and respect. Respect. The position is very important.
So the communication in Vietnam is more formal in place?
Yeah.
Yeah, you mean so?
Yeah.
And do you think that Vietnamese people, they are focused on the non-verbal or verbal language? More focused on which?
On verbal language.
Verbal?
Yeah. One more time, very formal, and the thing like this. In communication or daily basis job, everything should be done under a procedure, very formal, which was not the case when I worked in France.
Yes. And so during the time you work in Vietnam, have you met any difficulties in communicating with your staff?
Yes, sometimes, rarely, honestly, rarely. For example, you cannot, how can I say that? You cannot communicate, you cannot speak or request something from the staff if they are doing something else. So they are not listening you if you request somebody to do something and at the same time is busy. That's a big issue in communication. You cannot speak with somebody who is busy doing something.
So how can you overcome these difficulties?
Most of the time I have to wait.
Oh, you're waiting?
Yeah, I'm waiting. And I have to change my my way to do the things in terms of I know that I cannot ask or request anything if the staff is busy, nurse or the doctor. I should wait. So I have to change my habit a lot. Yeah, completely.
To adapt our culture.
Yeah, because Vietnam has a long history of culture, of everything. So I will not change Vietnam. That's not my job.
Very nice of you. Yeah. And could you please share with us the most interesting experience in communicating in Vietnam?
Probably the most interesting thing is when people listen to you,
Yeah.
when they listen to you and they bring for them. I mean, you said, well, for example, from today or from tomorrow we will do like this, like that, like that.
Oh.
We change the process. Well, be sure that it will be done like this, for sure. I mean, if you inform people and change the procedure, or if you say, okay, we will have a meeting from tomorrow every day at 8 and to discuss, you know, be sure that at 8 every day we will have this meeting. This is what we have here at 7:50 every morning. We have a meeting with all the supervisors of different departments. Everybody is on time and we can discuss. So that's for me that's a good example. You know that if you decide something and you explain what you want to do, you are sure that it will be done.
Yeah, that's very nice. And now we come to the last question.
Yeah.
We really want to know your overall impression on Vietnamese communication.
Or in
The overall impression. As,
not only working
or
in general.
In general, in working.
In working.
Okay.
People, staff, they talk a lot all the day, so they share all the information.
Yeah.
The thing is, communication is a process. Again, that's the same thing because of the culture, of the history of this country. Communication is a part of one procedure or one process. It means that should be done under something official. I would like to say communication is done like this because there is a procedure written and clearly. So I communicate. If you are my colleague, I will communicate because this is written that we have to communicate like this. So in the work, but also in the daily life outside the clinic, I would like to say people needs to have process and procedure for everything, even for communication. Yeah. After that, I cannot worry about the language, even I don't speak Vietnamese, and but here that's not really a problem. This is a problem for everybody here or outside because Vietnamese is difficult and people. I try to learn Vietnamese, but after 6 months. The taxi driver didn't understand me and I said, well, okay, stop. No need to go ahead with this process. So the language is a problem, but not here. The language, Vietnamese is a problem for communicate, but not here because we speak English and that's not a problem.
Not much difficulties, right?
Yeah.
So thank you for spending time joining our interview.
Yeah.
Thank you very much.
You're welcome. You're welcome.
So thank you very much.
Yeah. Bye.